to Forest Community Health Center. I would be remiss and hopefully won't go too long without introducing a few folks here. Chris Drake is our Executive Director and Deputy Health Officer. Hope Lavelle, standing next to him, is the Board Chair for our Community Health Centers. Todd Tennis, standing in the back corner, is on our Board of Commissioners as well as on our Health Center Board. And Dr. Nike Shoyenka over there is our Medical Director. So here we are in South Lansing at Forest Community Health Center. All patients receive care without regard to their ability to pay. Eliminating that barrier is only part of a systemic approach to prioritizing health equity in our healthcare systems. Today, Michigan is taking an important step to address healthcare disparities and improve equity in the delivery of healthcare to all Michigan residents. Early in this pandemic, the Racial Disparities Task Force brought together some of the brightest minds in Michigan to significantly reduce negative health outcomes for people of color in Michigan as a result of COVID-19. Under the spotlight of this unprecedented pandemic, problems we have seen for many years with other health issues emerged, and those other health issues that have also been problematic: diabetes, hypertension, cancer, infant mortality, maternal mortality. These inequities are actionable and require systemic solutions. The Racial Disparities Task Force identified the need and recommended annual implicit bias training for our healthcare workforce to create intentionality in recognizing and mitigating implicit bias. Implicit bias shapes the way providers interact with patients. Everyone is susceptible to implicit bias, even clinicians. And those unconscious preconceptions naturally seep into patient-provider communication. Dr. Marshall Chin, professor of healthcare ethics at the University of Chicago, says, reducing racial disparities in health outcomes is more difficult than simply standardizing the care provided to patients. Eliminating disparities requires truly patient-centered care, that is, individualized care by clinicians who appreciate the patient's beliefs, behaviors, social and economic challenges, and environments that influence their health outcomes. Michigan is a national leader in recognizing and addressing disparities that affect equitable provision of health care. These rules are being signed today, and they are critical to reducing residents. Health care services to all Michiganders, regardless of their race, zip code, or socioeconomic class. And I have the great honor now to introduce to you Governor Gretchen Whitmer.
Well, thank you. I'm really pleased to be here with you, and Linda Vail is a heck of a leader. We're so fortunate to have her and so many other people like her across our state in these public health executive roles. Dr. Kennedy, I'm so thrilled to see you again, my friend, and Director Hawks, glad to be with you, and of course, my partner, the Lieutenant Governor Garland Gilchrist, who's taken on a leadership role on a variety of issues, but this is one of the crucial ones over the course of the last 15 months in particular that was so important, and our state will be better off because of the work that they have done. We're also joined by a number of legislators, Representatives Bolden and Hope, Senators Hertel and Geis. Thank you for being here. And of course, the Forest Community Health Center, an essential facility that has been working overtime through the pandemic to keep this community safe and healthy. Since March 2020, COVID-19 has exposed and exacerbated so many underlying inequities in Michigan, especially the disparate impact of health outcomes by race. In months of the pandemic, Black Michiganders are 35% of confirmed cases, despite making up 14% of our total population. Black and Latino Michiganders were also twice as likely to die from this virus than white Michiganders. But this disparity went, of course, beyond COVID. Black, Latino, and Indigenous Michiganders also have higher infant mortality rates and higher premature death rates from heart disease than their white counterparts. And Black women are 4 times as likely to die during childbirth as white women. In the face of these glaring disparities, we knew it was important for us to take action here in Michigan. Guided by the leadership of our Lieutenant Crest, in combination with Dr. Janae Caldoun, our Chief Medical Executive, and Dr. Renee Kennedy, we formed the Racial Disparities Task Force, which the LG will speak about more in a moment. Our actions saved thousands of lives, and the task force became a national model. We didn't here in Michigan. Other states learned from the work that we were doing. So lives were saved across this country because of the work that happened right here. Us with the task force reminds us that when we tackle disparities head on, we can make meaningful change. The task force recognized the systemic biases existed in medicine, and these biases had real-world impacts on the care that communities of color receive. As we bias. Today we seek to address which are the thoughts, definitions of our consciousness, and are therefore heard to mitigate of biases in the lives of others. Some form of implicit bias. And we've got to acknowledge that and use proven methods to lessen the impact of that bias that we all bring to the table. By training healthcare workers on recognizing and reducing implicit bias, we can eliminate misconceptions and stereotypes that lead to disparities in outcomes. These rules are the culmination of work that we started last July. Around 11 months ago, I signed an executive directive instructing the Department of Licensing and Regulatory Affairs, or LARA, to begin a formal process of establishing implicit bias training standards for health professionals in Michigan. The rules were submitted to the legislature on April 14th. Now, the updated rules require both new applicants for healthcare licenses and registration and those renewing their certificates to complete mandatory implicit bias training. The training must be provided by a health organization, diversity, equity, and inclusion organization, accredited college, or a state or federal agency. And finally, proper documentation needs to be kept by everyone who receives the training. These new rules from LARA will help us mitigate the impacts of implicit bias and ensure every patient in Michigan receives the best possible care. I want to thank Director Hawks for the incredible work that she and her team at LARA did to craft and implement these rules. I know how much you personally were involved in this, Director Hawks, and so you and your team delivered these rules early, beating the deadline that we had originally laid out. And the work that you've done over the last few months will save lives and improve health outcomes for generations of Michiganders, especially those who have historically or systematically been discriminated against. They will make Michigan safer and healthier and more just. So as we emerge from this pandemic and take stock of our successes and our shortcomings, we've got to remain committed to leading with equity and rooting out systemic biases. There's no denying that it's been a hard year for every one of us. But I know that after all of our sacrifice and pain since March of 2020, we're all ready to get back to normal. We're ready to take Michigan to the next level, and the new normal is going to be better than ever. By addressing implicit bias head on, we can improve people's lives and power our state to new highs. Right now, we are busting at the seams with possibility. We're all excited for what is becoming the next safe chapter in our coming out of COVID-19. And it's up to all of us to harness the sense of possibility to address the issues exposed and exacerbated by the pandemic. And as our president likes to say, build back better. So thanks again to Forest Community Health Center for hosting us today. And with that, I'm going to turn it over to the Lieutenant Governor, the co-chair of the Racial Disparities Task Force.
Thank you, Governor Whitmer, and good afternoon to everyone. Thank you for attending here for this very important step forward in our state's response, not just to COVID-19, but into how we create better opportunities for better health outcomes for people across the state of Michigan from all walks of life. I want to thank Governor Whitmer for her leadership and her creating space for the state of Michigan to be a leader in the country in this regard. I want to thank Linda Vail for her courageous leadership here in Ingham County, Director Hawks and the entire Licensing Regulatory Affairs team for the work that you've done tirelessly on this and other issues. Throughout this entire pandemic, you've been stretched quite a bit. And I also want to thank Dr. Renee Kennedy for her role as a leader on the Racial Disparities Task Force. I'd like to also acknowledge someone who hasn't been acknowledged enough, I think, in the work of the task force, and that is Mr. Tommy Stallworth, who has been the director of the efforts for the Racial Disparities Task Force. He has really stepped up and stepped into this role and helped shepherd a number of key changes, evolutions, and reforms in policy and practice in the state of Michigan that are making our state a better place to live. I'm really need that we see all across has been made visible with deadly clarity throughout the COVID-19 pandemic. Hundreds of years of racial disparities and inequity continue to have a detrimental impact on the lives, health outcomes, and wealth of people of color across our state and our nation. This coronavirus pandemic has shown that this inequity is particularly dangerous and fatal, especially in the Black community, where the health of our friends and family, and my own friends and family, have been disproportionately negatively impacted. But thanks to Governor Whitmer's leadership, our administration took immediate action to tackle this racial injustice now and going forward in a way that serves as a national model that will help other states also improve in this regard. The struggles that we face, that we deal with from these systems, they are not struggles that were ordained to us by God. They are indeed the consequences of a system that was designed by men with indifference to the experiences of people who did not look or live like them. That terrible past presents a present opportunity for us to change the future for the better. It means that a different, more representative, more enlightened, more empowered, more inspired, and more inclusive set of people can make a different set of choices to establish different systems that are designed to achieve better and more equitable outcomes for a broader range of people. Knowing this truth, we have both the ability and responsibility to challenge and change these systems to eliminate these struggles. Just like every other challenge that we have encountered throughout the years, we can force change when we come together, demand solutions, and then do the work to make them happen. The members and the partners of the Michigan Coronavirus Task Force on Racial Disparities, which I am proud to chair, immediately recognized that medical bias can be interjected each time a decision needs to be made in ways that could be a detriment to people needing care. It's inspired by the words of the artist Benjamin Hayden, who once wrote that, fortunately for serious minds, a bias recognized is a bias sterilized. We sought to make this true in Michigan. So this task force, via letter from Dr. Jonay Caldoun, our chief medical executive, that was sent on April 20th of 2020, very early in this pandemic, took immediate actions to make sure that medical providers and professionals were aware of how this disease is impacting racial and ethnic minorities, including the role of bias in testing and treatment decisions when federal resources and guidance were so constrained as they were a year ago. We chose not to wait because the existing health disparities highlighted during this coronavirus pandemic had clear, quick, and deadly consequences, as I alluded to before. There was work to do to ensure that people of color had the same access to the same quality of care as everyone else. On July 9th last year, Governor Whitmer and I required implicit bias training in state government and amongst medical professionals. And that state government included her and I doing the training ourselves. By raising awareness and providing these tools to healthcare workers on how to recognize and mitigate implicit bias, We can help them carry out their mission of providing the best health care to every patient who they serve. Implicit, unconscious bias exists within each of us, and it is not limited to race. As public servants, we have a duty to understand how our biases can impact the lives of others. So this training will improve the practice of medicine in Michigan and upgrade what it means to be a medical professional here. It is yet another step toward us building a culture of responsive inclusion that further positions Michigan as a national model for equality, understanding, and fairness. It is also important to recognize and thank state employees across the board for their essential cooperation and collaboration in bringing these and other reforms to bear. At least one representative from every state department and agency participated in every Coronavirus Task Force on Racial Disparities meeting, a remarkable demonstration of this administration's deep commitment to achieving better outcomes for all Michiganders. We are constantly working together to build a more inclusive and equitable state government as well, for ourselves and on behalf of the people we serve in Michigan. So today, the executive order, we're putting these rules into place. We're making these changes towards improving equity in the delivery of healthcare across our state. Director Hawks will come up after me, and she will go into further detail about how these specific rules, their purpose and intent and focus will remain on reducing barriers into disparities and access to delivery of quality healthcare services. So as we see the approaching light growing bigger and brighter at the end of this COVID-19 tunnel, I want to reassure everyone that we're going to continue to work towards reducing disparities in health outcomes far beyond this pandemic. We will continue to work to eliminate unconscious biases, misconceptions, and stereotypes that can lead to disparities in how care is provided and experienced by Michiganders everywhere. I ask that every person in the state of Michigan, and we all have a role to play, join me in confronting racism and prejudice, overt and covert, head on, by recommitting to ensuring that diverse voices are heard and considered every time we have a chance to make a choice. We must look at the ways that we can expand opportunity, in particular for those to whom that opportunity has been historically denied. James Baldwin said that people who shut their eyes to reality simply invite their own destruction. But by addressing racism and implicit bias in our own lives, we can and will create a more equitable and just Michigan that will prevent this from happening in our state going forward. So thank you again to Forest Community Health Center for hosting us today and being a beacon of health opportunities and positive outcomes for this community and an example for the state of Michigan. I'm proud to be amongst this group that is continuing to stand tall for Michigan in all of the work that you do. So thank you for your continued dedication, service, and sacrifice. And now I'm honored to turn the podium over to Director Arlene Hawks from the Department of Licensing and Regulatory Affairs.
Thank you. Thank you, Governor Whitmer. Thank you, Lieutenant Governor Gilchrist. I am truly honored to be here today, sharing in this historic announcement. I thank you for your vision, your leadership, your trust in me, your confidence in me, to place me in charge of the implementation of this directive that will forever shape the way healthcare is delivered in Michigan. COVID-19 ignited a smoldering ember that has long existed within the healthcare community. The disproportionate COVID-related death rate among people of color further exposed disparities in recognizing and treating disease due to implicit biases. Last July, in the middle of the coronavirus pandemic, Governor Whitmer made it a priority for her administration to take steps toward addressing the inequalities that persist within our healthcare system. She tasked Laura with the job of developing and implementing rules that create annual training for all new and existing licensed and registered healthcare professionals. That will help them recognize and mitigate implicit bias. As many of you all know, probably have gone through the process yourselves, creating and developing rules is generally a long process and can take well over a year. However, the critical momentum fostered by disparities in health outcomes during the pandemic was a catalyst for emergency action. Working with our licensees, health professional boards, and legislative partners, I am proud of the work my team at LAR performed that allows us to announce these implicit bias training rules for healthcare professionals, created and signed in well under a year. And I have a couple members of my team here. It was definitely a great effort, and I am so thankful and grateful for their hard work and dedication. Thank you to you both. With dedication to thoroughness and timeliness, the LARA team researched the best practices and listened to our licensees and stakeholders. We engaged in challenging conversations and worked with representatives from 86 different organizations to ensure that we were approaching this training requirement in a thoughtful and deliberate manner. I am so truly proud of the steps that we have taken. With the adoption of these new training standards, Michigan is boldly leading the nation in addressing implicit bias within the practice of healthcare. The work that we have done underscores Michigan's commitment to having the best healthcare workforce in the country. Not only are we promoting high standards in technical knowledge and clinical skills, but we are also creating an environment where health professionals can better understand the ways in which they view and interact with the communities they serve. There is still more work to be done, and we must continue to ensure health equity for all Michigan citizens, but I am confident with the steps we are taking today that we are laying a strong foundation of systemic change that will improve the delivery of health care and lead to better health outcomes. Every day, public servants go into work hoping to make a difference in the lives of others. And I can say truly today, with my daughters in the audience looking on, my two beautiful daughters, that their lives, in addition to your lives, will be better because of the work that we have done today. So I thank you for this opportunity. I thank you again, Governor and Lieutenant Governor, for entrusting me and my team with this historic endeavor that we have undertaken. And it is now my pleasure to introduce Dr. Renee Kennedy, speaking on behalf of the Michigan Coronavirus Task Force on Racial Disparities as its co-lead.
Thank you. Thank you to everyone, of course, to our governor and our lieutenant governor and my colleague in public health officer Linda Vail, and thank you, Director Hawks. I cannot tell you how excited I am to be at this moment. The governor appointed a number of brilliant thinkers to a task force, and your words, "take action," are just resonating with me because that was our intent as a task force. We were convened because of coronavirus, but we were charged with how do we make things better for the people of Michigan during this pandemic and after. And I have to tell you, I was thinking yesterday after getting my belly full from it was a beautiful day in Michigan, we grilled out, and I thought, oh, I'm gonna run up to the store and look at, I needed a new microwave. And in that experience, a young white woman was assisting me, and we were typing in my order, and an older white woman came up and said, "I just want you to know that I'm next. I don't want anyone to get in line ahead of me." And so an older black man came out who was an employee, and the younger white woman helping me said, "Oh, can you assist her? She's next." Older black man went over to this woman, who middle-aged white woman, as I said, and said, "How can I help you?" She looked at the young woman helping me and said, "I want to make sure I'm dealing with someone who knows what they're talking about. I have a lot of questions, and I want to make sure that this isn't going to get mixed up." And the woman helping me said, "Well, this is our most experienced associate. He's going to take great care of you." Now, what was happening there? Was it because he was a man and she was like, "I want to only work with women on this"? Was it because he was older? Was it because he was black? I don't know, but I know that bias was clearly demonstrated in that encounter. And if we see that just in the routine of our lives, we know that in healthcare, it also occurs. Martin Luther King said, of all the forms of inequality, injustice in healthcare is the most shocking and inhumane. And so we intended as a task force to do something, to take action, not to just check boxes and have dialogues. We committed every Friday afternoon, late afternoon, I think it was a litmus test. The Lieutenant Governor said, let's see if they're really dedicated. And we were, and we came up with many, many solutions, and elevating implicit bias as a tangible strategy for change is one that I know my colleagues on the task force are very, very proud of. We are educators, we are researchers, we are administrators, we are community organizers, and we are all committed to the well-being of our region, again, during this pandemic and as we come out of it. So thank you both for your leadership, and we look forward to continuing to advance change for Michigan.
Hey everyone, we have just a few minutes for questions with the governor or any of our other great speakers on the new implicit bias rules.
And Director Hawks' daughters are Lana and Natalia, and they're sitting right there, in case you were wondering which young people belong to the director. All right, yeah, go ahead.
Governor, your next step in eliminating the restrictions with COVID is still a month away, July the 1st. Restaurants and bars are still at 50% capacity, although they can now remain open until 2 a.m. My question is looking forward. You have said in the past that you want to watch what happens to make sure there isn't a COVID comeback. Do you see moving that date up before July the 1st? Is it feasible or possible with you to not have to wait the full month and have those businesses lose 50% of their business? Or could you roll that back sooner, and then if there is a COVID comeback, reimpose restrictions?
Well, let me just start with this. Today is June 1st. This is the first day of this phase. In this phase, we have actually been able to get out of most of the protocols that we've had. There are not limitations on outdoor dining. There remain some, 50%, but not a lot of the other same protocols that were there with regard to indoor dining. We still know that COVID is present. We are not at 70% of our population having gotten vaccinated yet. That's the goal. I still hope that we can hit that goal by July 4th. But it's hard because, of course, things have slowed down. I was chatting with Linda Vale earlier today, and they were at Potter Park Zoo this weekend, and were able to give 45 first shots in arms. These smaller events, instead of the big one at Ford Field, these are all critical components of what's happening in communities all across the state. So we're going to continue to hope to get to those metrics. But we wanted to say by July 1st, we will plan on, and we will, there's nothing foreseeable that on the horizon that will change this plan. But of course, we always have to have that one footnote that if all of a sudden there was a variant that showed up in Michigan that was vaccine resistant, we might have to revisit. No one thinks that's going to happen, but that is the one situation that we might have to reevaluate.
So Governor, based on what you know now, can you assure the people of Michigan that we're not going to have another statewide shutdown, but we might have regional shutdowns? Are those completely out of play?
At this juncture, I mean, when you listen to the CDC, we had a call with Dr. Fauci earlier today. There's not an indication that that's something that is likely to happen. We feel very confident that we are really almost on the other side of this. I hate to say we're out of the tunnel because we're still in it, but we have got the tools we need to stay safe now. I am hopeful that the CDC can promulgate and have comfort that these vaccines can be used for younger people. I think that's the next big step that needs to be taken as a country. And as I'm going to quote Linda Vale again, but we were chatting and she said as soon as we're able to get the babies vaccinated, we're going to be feeling a lot more comfortable about where we are and if people are going to make their choices. But we still know that the best thing you can do to stay safe and to protect your community is to get vaccinated. And it's easier to do now than ever.
Governor,
Paul?
Thanks, Governor. So if I'm a medical provider, let's say a medical doctor or registered nurse, how soon do And the second part of the question, just given the nature of our society, are you anticipating any resistance from a minority of medical providers, including possible litigation on this?
I wouldn't predict that there's going to be litigation. I predict there will be questions. People want to understand when we talk about implicit bias. I think that some people come to the conversation making assumptions that we're talking about people being racist. That's not what implicit bias means. Implicit bias means every one of us is an amalgamation of our experiences. We come to the table with different, having grown up in different parts of the world, with different family members, with different communities, and that informs actions that we take or assumptions that we make, and that's why it's important that we call it implicit bias. Whether it is someone with a southern accent that you make assumptions about maybe their politics or their education level, that's implicit bias. And so understanding that we all bring that and understanding the mechanisms by how we can address it yields a more just society, especially when you're making decisions that impact people's health, or if you're a state employee who is impacting people's people's lives in important ways. Now, I should have maybe handed that over to anyone else want to add something on this?
To answer the first part of your question, how soon will individuals be expected to take the training? So this rule is going to affect June of 22. And so new licensees are required to take 2 hours of training for new licenses. And in terms of renewals, it is expected that it will be 1 hour per year for implicit bias training.
And so if you already have a license, it's not required until you renew.
That is correct.
Thank you.
Governor, the training that you underwent and the state employees underwent was mentioned. What can you tell us about what you learned about your own implicit biases?
I think it's, it was very helpful to, you go through a number of exercises and you make choices and then you get an opportunity for feedback. I learned something every single day. I think, as evolving humans, we all should strive to learn something every single day. This implicit bias training that we have for state employees, I thought was comprehensive. I think it maybe took me an hour and 30 minutes to complete. And going through different real world exercises that might happen in an office setting or might happen on the road was really helpful to take that pause that I think everyone needs to take on occasion and really understand what's happening here and why, so we can do better.
We have time for one more question.
On the budget, there's about 10 days close to revenue conference now. Are there legitimate discussions, negotiations happening? Are you confident that people are actually talking and working toward, bona fide target agreement? Where do things stand?
Yeah, I think so. We put out, we found some common ground with the legislature. They put out some statements, same time we did, that we had the makings for what would be a good budget process. We're continuing to work that. Dave Masseron, our budget director, is in regular conversations with the approach chairs in all 4 caucuses. It's, you got Curtis Hertel here if you want to do an interview with him after we're done here. But I think, I'm confident that we're going to navigate this and find some good common ground and be able to get the relief, the federal relief that came from the Biden administration and the Trump administration that hasn't been deployed yet because it hasn't been appropriated. We got to get that out the door and into our classrooms, into our businesses, into the pockets of hardworking Michiganders who just need a little help to get back on their feet.
That's all the time we have.
All right.
Thanks.
All right. Sorry, Eric, I know you drove all the way down from Traverse City. See you soon. All right. Thanks, everyone.